These are community health centers. They serve about 4 million Californians enrolled in Medi-Cal. But payment rules for health centers are behind the times. And for years, they've made it difficult for health centers to meet patients' needs. In the face of the COVID-19 pandemic, these rules are really hurting patients. See, historically, community health centers have only gotten paid for in-person patient visits, which have dropped during the pandemic. It's one of the reasons why many health centers are struggling to stay open, which jeopardizes access to care for patients like Veronica, who has diabetes. Before COVID-19, Michael had to take time off work for an in-person visit if he wanted to discuss lab results with his doctor. Health centers are now able to bill for telehealth and phone visits, but it's unclear if this will last beyond the pandemic. Janelle was laid off from her job and struggles with anxiety over her family's finances. When she visits the health center for bad stomach pain, her doctor knows she also needs help from the on-site behavioral health team. But the health center won't be reimbursed if she receives both services in the same visit. Janelle will have to return another day, which is both inconvenient and potentially dangerous during a pandemic. All of these outdated payment rules are not in the patient's best interest. What if we could create a modern, patient-centered payment system? Rather than billing per visit, health centers could be given a fixed amount per patient per month and the flexibility to provide care in ways that patients want and need. Under a patient-centered system, Veronica would have stable access to care for her diabetes, even during emergencies. Michael could continue telehealth visits with his doctor beyond COVID-19. And Janelle could have access to same-day integrated behavioral health services, like a social worker, to ensure the stressors of the pandemic don't build up and affect her health. Under patient-centered payment, health centers could better serve those dealing with other social needs, like housing and food security, which will be so important in the wake of the pandemic. Health centers could even provide care beyond their building walls, in community settings like churches. A patient-centered payment system would increase accountability, since health centers would be required to meet new standards of access, quality, and outcomes for patients. There's already evidence that these programs have worked in states like Oregon, Washington, and Colorado. Community health centers already have deep roots with populations that have been hit hardest by the COVID-19 crisis. With patient-centered payment, health centers can finally deliver the care their patients deserve. Together, we can truly modernize care in the Medi-Cal program during the COVID-19 pandemic and beyond.